All right. Just about there, guys. Thank you so much. I will go ahead and get us kicked off. So for those of you who don't know me, I'm Fran Ayala Somayajula. I'm the president of Reach Healthcare, the founders of the Match Coalition. Of course, the Match Coalition is also co-founded with HIMSS. Just about there, guys. Thank you so much. I will go ahead and get us kicked off. So for those of you who don't know me, I'm Fran Ayala Somayajula. Make sure that the feedback doesn't work there. There we go. Along with our co-chairs from HIMSS, as well as with Twin Logic Strategies. And the Match Coalition, as a reminder, is really focused on advocating for the clinically appropriate application of technology for maternity health and well-being. And we have folks from public as well as private sector who participate. Anyone, in fact, who's interested has a calling towards addressing the needs of women throughout the perinatal period, which begins everywhere from the prenatal, from conception all the way through to postpartum, are welcome to participate, inclusive of those who have a focus on family planning, as well as on family building. So addressing things like fertility needs, as well as diverse populations of birthing people. So we really encourage those who are interested to participate with us. We spent a lot of time and energy educating legislators and many others on the importance of policies, as well as research and investment in technologies that make a difference in the overall lives of women. Thanks for those who are given the shout outs, and welcome Cherise, and thank you everybody for being with us today. I am so excited because we are live at HIMSS. And if you don't know HIMSS, HIMSS is the Health Information Management Systems Society. The organization was founded, gosh, I don't know, I hope I don't butcher this, is it like 40, maybe 40 years ago? It's been around for quite a long time. It is a professional organization of information management professionals. And every year annually, they put on the global conference. Of course, they are a global organization that has representation across the world on all continents. And they're doing amazing work. But the global conference is one in particular that's near and dear to my heart, because it's where folks from everywhere come in and have the opportunity to network, to showcase their innovations. There are topics on a variety of related areas within healthcare, and maternal health being one of those. And several years ago, HIMSS raised their hand and were willing to join us on this journey of maternity, of maternal health. And we were just so honored that they recognized, as part of health equity, the necessity of addressing the needs of women and birthing people. So it's just been a true honor. And to know that we have with us today Joy Rios, who is the founder and the CEO of Hit Like a Girl podcast. Now, that's a name that you should perhaps remember for those of you who were with us a few months ago when Cherise Maynard had joined us, because she's also a leader within that organization, and gave us sort of a little bit of a trailer, a little bit of a teaser, if you will, on Hit Like a Girl. And so today, to have Joy, the CEO, with us is extra, extra special. So without further ado, we're going to go ahead and get started on this special edition of the Match Coalition. I'm going to be passing it over now to Joy Rios. Joy?
Fran, thank you so much for having me. It is such a pleasure to spend time with you and be here for this special event. So a little bit about Hit Like a Girl. We are started out as a passion project about 5 years ago. I've been working in healthcare and health IT, really with a specialty in navigating value-based care and helping clinicians understand what quality measures and metrics within their technology that the government requires to really understand what reimbursement rate that they're going to get. But eventually I came to the realization that there was something else really missing and needed within our industry, and that was the voices of women. There was a lot of conferences and a lot of places when big organizations and decisions where, tables where decisions are being made, where not as many women and underrepresented voices are included. And so I took it upon myself to start amplifying those voices. And so to date, we have interviewed more than 300 women within the industry and really talk about understanding this like 30,000 piece puzzle that is healthcare in the US. And each one of us holds a piece of that expertise and shares their piece of the puzzle with our audience. And so it has honestly been the privilege of a lifetime to be able to speak with, learn from, and gain the perspectives of all of these women experts, and then also share that with our listeners and audience. And since then, it has actually grown into much more than a podcast. We are also a community of women who actively network and support one another along our career journey. So it's been wonderful to have multiple generations, people that are just beginning their career and perhaps don't have quite an entry into the health IT industry, to those that are senior level, and making sure that communication is running all along there. So happy to be here with you today.
Well, Joy, we're thrilled to have you, and we'd love to learn a little bit more about sort of where you have been thus far and really where you see your organization going.
One thing that has been interesting and definitely defining was the pandemic. It was one thing to just be a podcast and amplifying voices, but I think when all of us were in isolation and, in our quarantine, one thing that really stuck out to me was the need for connection and community. And so back then, and once the vaccines were approved, we kind of laid the groundwork for what is to come. But I was in a very fortunate position. I was able to take the show on the road. We went around the country to 32 states and met up with women in different regions to sort of do what was safe at the time, walk and talk about what they knew and what their experiences were in healthcare, especially at that time. That's not the kind of thing that we can do every year, but I have now taken it on that this is like my full-time gig. So I am actually planning on taking the show on the road again. We will be doing more live podcasts. And so basically combine the sharing of that expertise of the women that I get to interview with the communities that they are in. So we're looking at doing 10 cities across the country, 8 weeks starting in August, leading up to the health event, and really going everywhere from Southern California to the Philadelphia, New York, Boston, DC, all the way up to the Pacific Northwest, and then eventually landing in Vegas for the health conference. And so kind of really doubling down on giving insight and a visual of all of the ways that women, the experiences that women have and how they are contributing to all of the good work that's happening in healthcare. So I'm envisioning being able to highlight everybody from, the women that are in C-suite and like have a CEO or CTO. What is a day in her life like? Does she manage a family? And how does that work? Versus folks who also are caregivers, and if they have to, balance taking care of their work with a special need child or a parent, and kind of everything in between. So there's a lot in the horizon, at least through the end of the year, which I'm very, very excited about.
I absolutely love that, Joy, especially when you called out special needs, right? This month actually is National Autism Awareness Month, and autism, as well as many other areas of neuropathic needs, and sometimes families learn very early on the challenges that they need to be able to prepare for relative to their children, and resources and preparing families is something that's really important. Do you see a lot of technologies coming to play that are sort of emphasizing the need for health literacy for, variety of conditions, and preparing women, as some may find out very early on during their pregnancy that they may have to provide for and accommodate for special needs of their newborn.
Okay, so I had a conversation just a few weeks ago. It will be coming out, it will be releasing soon, with a woman CEO who is autistic herself. And I had the opportunity to learn from her perspective of, she's basically helping primary care physicians who are on the spectrum, or who, ADHD to autism and kind of everywhere in between, to be able to help their patients. And with coming from that understanding, and what are the special, requirements or considerations that should be taken for patients, everything from, here we are at a conference, she had shared with me the glasses that she wore were tinted in such a way to kind of reduce the level of light and from being overstimulated, to kind of protect from that. And, engage, helping people understand the type of engagement, or where she was really sweet, where she was talking about, she has a hard time lying, right? Or doing small talk. Everything is very matter of fact and direct. And so the engagement that she was sharing that she experiences with people, it's helpful if they understand that. And it was honestly really lovely just to get her feedback and experience, and know that she has built a company to help patients that experience the same thing. And I'll stop there.
Well, I absolutely love that. And I'm sure there are many others whose heads are nodding. Let's go back a little bit. Innovation and investment being made available for female entrepreneurs, innovators. The numbers had looked like we were kind of going upward and then sort of dwindled down again. Can you talk to us a little bit about this yo-yo that's happening in investment when it comes to female entrepreneurs and innovators?
Well, I have a lot of thoughts about it. I can't necessarily speak to the why it is. I think that there's probably some, fear within the economy, what's going on, and there's stories that people tell, whether they are true or not. But, we do have some divisiveness in this country that contributes to where money gets spent. There's absolutely more femtech organizations, and organizations that are committed to making and providing solutions and technology for women's health than ever before, which is fantastic. But the funding still needs to, it's still, I think, 0.2% of all of the funding that gets out there. And so one of the things that shows up for me is, not coming from it as a thinking of it's the right thing to do to invest in women, which I think that we know it's the right thing. There's so many women's issues in particular that are not specifically addressed and do require attention and research and products designed for them. That we're leaving trillions of dollars on the table. Ultimately, the opportunity to invest in women, it's if we could be I read a statistic just yesterday that said we could actually expect, if you had an investment of $300 million, you could expect a return of potentially $3 billion. That's how much is available, because we are just sort of not addressing these needs that basically half the population are could benefit from. So there's a right thing to do, good business sense, and I would love to see, more investment. But it is a struggle. I think that, when people who are controlling the purse and who gets what, sometimes it's hard to convince them, of our worthiness, which is unfortunate. Oh,
you're there on site at HIMSS. I know it's just getting kicked off, but what are you anticipating seeing on the show floors? And
well, there's a few things. Look, they have a patient experience whole center, which is really great. It's great to have that there's patients patient advocates that are here and speaking on behalf of that experience. There's a whole cybersecurity, also very important. One thing that I have on my radar is there's a new HIPAA rule that's directly related to women's health and reproductive health and the sharing of that data. Why is it important? What's like the absolute amount of information that needs to be shared among different clinics and healthcare settings. That's on my radar. There's also the interoperability conversation and making sure that everyone's prepared to get the right data at the right time to the right people. And of course, that has been an ongoing challenge. We're hoping that we're getting closer. But I think that one of the topics that there is a conversation today about Dobbs. That's happening, since the Dobbs got overturned back last year, that it is sort of a muddled place. So I would like to see more conversation around how we're going to handle and navigate these murky waters, because ultimately that's what it is. And I would like to see more, protection, basically, of women and underserved communities. I'd like to hear more of their voices. But I'll be honest with you, I think I forget sometimes how much I've surrounded myself with, a lot of women in the healthcare industry. And being here, you definitely see and feel that we're still very much male dominated. And so making sure that they can empathize and understand where we're coming from. And to that point, actually, Charisse is leading a conversation this afternoon at 4:00 to advance gender equity. And she'll be interviewing the CEO of Redox to talk about their inclusion efforts. What's worked, what hasn't worked, what are they planning for the future, and also like lessons learned, because it's not a one and done, checking of a box, but an ongoing commitment that needs to be made. And so I anticipate that there will be some big conversations, potentially some uncomfortable ones, but I think that they need to be had, and we're here for it.
I absolutely love that. And I remember that session, that event last year at the 2022 HIMSS, and it was phenomenal. I mean, we just had, I don't even think there was a seat left, and there were folks standing in the back. It was an awesome program. And it's good to see that there are efforts being made to hear both sides, right? And to balance the voices and to balance the skills so that we do appreciate where efforts are being made, because that's really important. And to learn from those as well is phenomenal. So on the maternal health side, our group, we have a lot of folks from policy teams that are represented as we work with state as well as federal legislators. You're in fact sitting, I don't know if you realize it or not, but the room you're sitting in there at HIMSS is actually been granted to us through the government affairs team at HIMSS, and we want to make sure we thank them for that. And I'd also like to pose a question relative to policy. What do you think needs to be known that's maybe not understood, that is making for maybe some might say some reverse decisions, some back steps in terms of progress that are making for this sort of not impressive investment or allocation of funding towards female entrepreneurs and technologies that are really focused in on femtech? What do you think might be needed, or what would you like for folks to know?
I think that we really need to be honest with ourselves around the potential dangers of some of the technology that's coming out. I mean, when we talk about AI, I love it. I'm actually a huge proponent of ChatGPT. I think I'm using it on the regular, but I also believe that, technology has just as much opportunity to do harm and, be in the bad place as it does to do good. And we really need to be careful about what boundaries we set and how do we define, what is useful. I had a conversation a few weeks ago about technology and specifically around AI, and it came along the lines of automatic denials that were like, okay, we have this technology that now insurers essentially are using to auto deny hundreds of thousands of claims 1, 2, and 3 times, which essentially makes it more difficult for patients to get the care that they need, to trust that they can get the care that they need, or they even want to engage with the system, and then that they're not, going to be financially burdened at the end of it. And so if we truly want to be able to like the amount of investment that we have made within healthcare and technology over the last 10 years, I would love to see our outcomes match that, but unfortunately that's just not the case. And ultimately I think we need to have an honest conversation around either how do we rein it in, or what needs to change, because status quo is absolutely not working.
Yeah, I mean, that takes me back. Was it the case in Georgia of like 6,000 rejected claims were made? And
in 0.2 seconds, that's
yeah,
what's happening.
Yeah.
And they all get signed by an individual clinician, that it would be impossible to review each of those claims and deny them. So
yeah,
that's something to be aware
well,
of.
it wouldn't be impossible. I mean, the way that we do it, let's look at the reality, right? The way that we do it today is that, a provider may submit a claim and they wait and they wait and they wait. And it can be months, several months before a claim actually gets approved. And, when I think about maternal health, and especially now with, doulas, and of course we have a tech-enabled full spectrum doula practice. And I think about the work that we do and having to go through a pre-authorization. Like, you got to be pre-authorized. We know that the patient, is pregnant, but we got to go through a pre-authorization, and then you have to submit the claim, and then you submit that claim and you don't know whether it's going to be approved or not approved. And so essentially, as I look at this, a little bit, Joy, it looks to me as though we are, the technology is just enabling us to do more of what we've already been doing, yet faster.
That's what we need to uncover,
and that's what exactly, because that's what's been happening, and we know that that's been happening for a very long time. And we have certainly some very seasoned clinicians who are on the call to us today, representing multiple institutions, who are likely nodding their heads on that. And so it's something that we definitely have to look at. But but then there's the flip side. I noticed you said that you've been using the Chat GPT on the regular, right? Because it can be good, right? The technology can be for good, but it's sounding like there's some education and some ethics that need to be introduced with its adoption. Who do you think we should begin with that? Is it through policy and regulations at the national and state level, or do you think it should be more grassroots education within health?
I think it needs to be all of the above. I think it needs to be a combination of, government, corporations, and grassroots. I think that trifecta is absolutely what's needed, is working together. And another thing that comes up for me, just want to make sure that I am able to express it, specific to like maternal health. I feel like I had a conversation the other day where somebody was telling and sharing with me about a procedure that her husband had on his hand. And she was like, he had a thumb injury and walked out of the hospital with a 10-week plan on all the exercises that he needed to do to get his thumb back in working condition. And yet moms have babies every single day and don't have the same or even close to the level of care. And that is something that I just feel is disheartening isn't even close. It doesn't even capture it. And I just feel like that is an area that I would like to see us make improvements on.
I just love you for bringing us to that point, and I would love to welcome others to turn their cameras on. I know we've got a couple of entrepreneurs amongst us as well, and they may have some questions for you. So folks, if you would like, I'd hope our attendees, participants will join us with your cameras on, and let's have a bit more conversation here together. Let me see here. I'm just going to remove this spotlight. There we go. Hi, Gloria. Would you like to ask the first question?
Absolutely. I think one of the issues that we often fail to appreciate is the aging in the woman, the aging individual. And what I see is a lot of negative stigma that if a woman of 78 said she wanted to, you know, pursue something, specialized healthcare, it would be frowned upon. What is your thoughts or feelings about age? And I don't think it's the same for men. That if a man were the same age, it may not be as negatively interpreted or perceived. It may not be the same hurt.
I think that, well, the thing that comes up for me, and I don't know that I will do as much service to your question as maybe Fran and I can together, but like I think there's a lot of ignoring of women's issues. I mean, menopause, I believe, is a really a big one where we haven't really educated people. I feel like we educate folks up to a certain degree, and even then we don't necessarily do the best job of what should we be expecting? How should we anticipate that we're going to be navigating our bodies changing? And can we learn from each other? And I think that that goes in even to as our older years as well. And I feel like, especially with women, youth is something that prized and we're, easily talked about more than anything else. And I feel like I've heard that when women, when they get to a certain age, just feel invisible. They feel, and maybe there's a good side to that, but I think ultimately it's doing them a disservice. And I think that we need to bring those conversations to the forefront. Again, it's actually it's a challenge, but also an opportunity.
Exactly. And I think the whole concept of beauty with aging has, been negatively perceived.
I've seen a lot more people starting to embrace their grays, which has been lovely. Then I think that the pandemic started to help with that, a little. I'm sure people are going back, but I've definitely seen a lot of women my own age just kind of stop covering it up and letting themselves get old. And I love every wrinkle that I have. I just guess what? This is the result of me actually living this day and living this life, and let me actually be grateful for that instead of, wishing it away.
So, it makes me wonder, is there perhaps a little bit of misappropriation of where we place investment, right? Because the cosmetic industry is a huge industry and there's lots of money that gets poured into that particular industry. Whereas less in other areas where it could be just as viable and perhaps have more of a greater impact on health and well-being.
I think add into that the bell curve of everybody entering the Medicare age right now. The population and the numbers, actually, there's a lot more people that are getting into that, up 60s and older crowd. That's 100% an opportunity. We should be investing there.
One space where we often don't like to talk about it, but it's a reality of the complications that we see in maternal health is the rising age, right? The increase of age in women as they choose to start a family. And that also contributes for some to complications, in part because, as they're aging, then chronic diseases, pre-hypertension, diabetes and other conditions become more prevalent. And those things can then result in further complications during pregnancy. And so monitoring, providing for education that's more targeted to help ensure safety and healthy mother and child are super important, but there seems to be less emphasis or even acknowledgement on those as being some of the challenges that are being faced. There was a comment that Karen actually put for us. Thank you, Karen, that she just was looking at the dollars spent on wellness beauty ranks. The beauty itself ranks at the top. And yet when we define wellness, I don't know for you guys, but I'm sure it's true that when you think wellness, beauty is not the first thing. My cold cream that I wear at night is not the first thing that comes up my mind, right? Rishi, it's so good to see you with us. Is there a question or comment you'd like to add?
I just add one thing, Fran, to what you
Yeah,
just
please do.
of pregnancy and individuals. And I think one of the areas that I would like to see addressed is reproductive endocrinology and infertility being made more accessible to everyone. At this point, it is so expensive that it really is not something that an individual can even think about getting care for, because it seems like most of it is out of pocket, or if even if insurance pays for some of it, it's so expensive. And I just think that that's a big area where there's a lot that could be done in making this accessible to them, so that they do have more options with their fertility.
Absolutely. And more education around its availability and resources, right? Options or choices for how to really be able to pursue and to afford.
Yeah.
Yeah. Very good points. Rishi, you just came off a camera, but oh, there you go. You're back on. It's good to have you with us. You had mentioned that your organization is working on technology that's focused on contractions. Do you want to tell us more about that?
Absolutely. So we've developed a very small device, which basically is a self-administered at-home device, which measures contractions mainly for the third trimester primarily. And we have it patented. Every approval is in process, and we have linked it to an application which basically records the vitals at home, the contractions, which can be monitored by the clinician or the practice or the OB/GYN or the hospital at the back end, and which gives them a better understanding of whether the contractions are really taking place. And they can then provide clinical advice as to whether to come in to the practice or go straight to ER, and make more informed decisions. And this I think will help patients and pregnant ladies in rural areas more and more, and also in busy cities and towns where traffic is a big, huge issue. So,
I love
yeah,
that.
I mean,
I absolutely love that. Now, it makes me think, and this kind of goes back, Joy, to some of the comments that you were sharing with us from your perspective, as you've been around the country, you've been doing a lot of interviews and talks, and some of those with executives of large healthcare facilities, right? That adoption of these technologies is not always so easy. Would you agree to that? And sort of when you have someone like Rishi who's bringing in technology that could be useful, and I'm sure there are many of us who've heard the stories of women who go into facilities complaining of contractions, thinking they're in labor, being told, no, you're not, being sent home, and then lo and behold, the baby is born. That there could be some usefulness to this, but yet in the same, there's some challenges. What comes up from what you understand as in the minds of those who are adopting the technology and their readiness for it?
The thing that comes to mind is, okay, it's wonderful to have a technology that you're bringing as a solution, but you need to be able to make sure that it fits into the healthcare system. So find the entryway. Is it reimbursable? What does what I tend to also think on the value-based care side of things, if you can look at all of the quality measures that are being tracked, is it something that could support any of the initiatives that are already in place? And as you're going through, the path of trying to get your entry into healthcare, I personally like to think about, like, okay, let's tack on to something that's already happening and that has teeth and people that are invested in, so that you can actually support them in their mission while also helping to continue supporting your own mission.
I love that. I absolutely love that. And I know that Sue, you probably are nodding your head a little bit. You spend day in, day out engaging with hundreds of hospitals collecting data, and you've got your hand raised there. I'd love to have you to come off of mute and ask your question and share with us.
Thanks for all your work, Joy. It's amazing, and appreciate the ability to ask a question. I guess I'm throwing out there looking for guidance on, we're about to launch a maternal infant linking opportunity, linking mom's data with infant data. And again, what are the insights, or where would you think we, in your work, that there would be opportunities, especially I think on the prenatal side as we begin to build this out from the actual birth episode, but we have a lot of data on the birthing episode forward. Where can technology really help us to learn from the birth outcomes with mom and baby linked to improve prenatal care? I know that's a big question and I don't want to boil the ocean, but I think there's huge opportunities for us to learn and reflect on how we deliver prenatal care as a result of that.
I don't mean to like hit the same tune over and over, but I do think that even if there's not a clinical quality measure that exists that addresses what you are talking about, perhaps proposing one, create like submitting a quality measure. So you're like, hey, this is important and this is why it matters. And if there's research that backs up why, the outcomes that it could help improve, those are worth a lot of, I'm going to say points, which ends up translating into dollars. And I'm like, if you were able to tap into a quality measure, even if that quality measure doesn't exist yet, get involved in submitting one and hopefully getting it approved. Because on a grand scale, that is the kind of thing that clinicians nationwide could tap into. That it wouldn't just be in one community that you're making a difference. It would, throughout the whole system. I don't know that that's the answer, but that's an idea.
Well, yeah, and I think it's an important reflection because again, the correct cadence of prenatal care are what women, what will help birthing people have the best and most successful outcomes. I think is still something that we need to solve. We have this traditional way of providing care that has never really been disrupted. And so how can we use this technology and some of the data to think differently about that, which again, I think would impact moms, birthing people in a huge way, and being able to have more shared decision making with and engagement with their care versus trying to worry about transportation and childcare in order to, be able to make their appointments.
Well, we have that designation, the birth-friendly designation.
Mm-hmm.
And when I say those words, I think in my head, whatever that's supposed to mean, because it really hasn't been defined what that designation really implies. And to say that we're just capturing data, that a facility captures data, therefore they're birthing friendly is that doesn't add up. That's insufficient. And so maybe there too, Sue, there's an opportunity to really help in terms of the better defining of what that actually is, so that we can get down to the brass tacks of measuring the things that really matter when it comes to, childbirth and labor and delivery in general. Hi, Sharice, you've joined us. Did you want to make a comment? Join us on camera. Hi there.
I think she's coming up. Oh, here, I'll mute. Go ahead.
I don't think we can hear you. Want to try again for us? Or maybe say it in the room, and Joy, if you could repeat the question, might that help?
Oh yeah, that's a possibility. She's coming over, so she will be, yeah.
Please do come to the mic. That's great. Love seeing you guys right there in the meeting hall.
What was your question?
I didn't have a question. I just was thinking how wonderful it is that we're having this discussion. We're trying to do a good job on the ground, on the floor, on the ground, in doing the grunt work here today. But I just thought it was amazing that we're actually having this conversation and how important it actually is. That's my comments.
I appreciate that comment. It's a very big one. And Karen, you're amazing as well, putting some really big things into the chat window. Did you want to comment on that graph from McKinsey that looks at alternative prenatal care that you've been pondering for a while, and what would we would use to replace it with remote patient monitoring and home visits?
Sure. I just happen to have one of those days where I've got all my windows open with research. So I'm in a space that's really curious about how we can shift care to maternal health supports and into the homes. And so I'm of course very steeped in more than curiosity about how we use digital and remote monitoring in conjunction with having more community and home-based care. So if we re-envision the prenatal sequence, which of course we need to, how does that incorporate all of these different methods that are both high tech and also very high touch and very culturally relevant to people? And thinking about the impact of that is something I spend a lot of time with. So I don't know if you have contributions or if there have been discussions at the conference about the intersection between, elevating our digital interventions and supports, and also how that influences home and community-based services.
I will be on the lookout for that for those conversations. But we are just getting started. So, really day one of the conference is just, yesterday was sort of pre-conference. Today's the official day that it starts. So we have a team of people kind of dividing and conquering all of the different events to, and we'll end up, sharing all of our notes and thoughts towards the end with everybody, afterwards. But yeah, we'll be on the lookout and report back if that's okay.
That's a great one. And thank you, Karen. That's a great one, Joy, for you guys to be on the lookout for. As Karen was posing her question, it brought me back to your first roadshow, where you were encountering folks and everyday individuals, right? And they were joining on the hikes and some technologies that you had been asked to trial, right? You had some technology, some devices, some things in VR and other places that you're being asked to try out. And I remember us having a conversation. You were like, Fran, how would this really work? Is this really practical in the home? Does this really make sense? Does this make sense? We spent a lot of time talking about the clinical workflow. Well, what about the patient's life flow, right? Does it really work in the context of the home environment? How do we make it easy?
I remember that conversation clearly. I remember because they have the VR headset on and you're like, okay, here's going to be 30 minutes of relaxation. And I just was imagining, what if I was a mom of 2 or 3 and taking my attention away from being in the, environment of home, of not being able to see what was going on? That could be a real challenge. And perhaps you do that when they nap or something, but I'm sure that that's easier said than done.
That's right. It is. Many of us would agree that would be easier said than done. And it does create for challenges. And there have been, many organizations working on creating simplistic at-home kits for all types of things, right? And we're now starting to see, we certainly saw a little bit of that with self-testing, self-diagnostics. That's an area where we've seen some improvement. COVID sort of pushed that a little bit to make it easy. The other day, my daughter wasn't well and I'm on the phone with the nurse and I'm checking her glands and I'm doing this and I'm doing that and I'm administering the test. And I'm like, okay, let's give it a couple of minutes. I'll ring you back if, things turn out and, look like they may be positive. And that's a lot of empowerment to the patient and the caregiver, but it's also a lot of burden, right? A lot of burden. And so what are your thoughts about that aspect? We have a rapidly aging population. There'll be more people over the age of 60 than there'll be under the age of 24 by 2050. And then, as you had acknowledged, we're having being a personal caregiver and most women, majority of women representing women 45 years of older, representing the caregiver, personal caregivers. Are we equipping individuals, or are we equipping the consumer in a way that makes for the simplicity and what we're sort of creating with remote monitoring, and even with what we know today in terms of the way that the home visit system is structured.
Well, we're asking a lot of them, aren't we? We're asking that, like, okay, maybe they have access to an app on their phone, or maybe it needs to, like, all of the hoops that need to be jumped through. Whatever technology that we are creating, we need to consider the burden and literally like take as many steps out as possible that somebody can access whatever care or product or service that they're trying to get to as quickly as possible, considering and also taking into account that the training and education that is required. Like, it's amazing how much technology that we create, but it needs to be coupled with education and training and support. And I don't know that we're doing that on a holistic level, like as a system, but I'm sure that there are organizations, you know, when you get a good package, right? Like if you get, that when you get your new iPhone and unbox it, that it feels really good and you know what to do with it and it's somewhat intuitive. I think that a lot of additional investment, not just in the technology itself, but in communicating what it does, how to use it, how to engage, and really empowering the patient so that it becomes, a pleasure, hopefully, to use their product or service, even if it is under stressful situations, more so than a burden. And that's asking a lot of organizations too. So, I mean, we have a lot of work ahead of us, that's for sure.
Well, I just love having you with us here today, Joy. You have been a true joy to have with us. We are, again, really grateful that you guys were able to participate and join us. And just some closing remarks here from folks, who definitely believe that home and community-based health education plays a key role. I mean, I'm sure there are many of us who agree with that. I want to also just shout out to Sharice, who's put a link in for Hit Like a Girl podcast, some details. If you'd like to learn more about the work that they're doing, their organization, participate in the upcoming roadshow that's going to be happening later this year. That is so exciting. And I just want to pause for just a second as I say thank you for everyone for joining us, and just remind you that the conversations that we have had today, we've touched a lot of touch points, a lot of topic areas, hot buttons within healthcare, and in particular within maternal health and women's health. And that's just an indication that there is so much work that needs to be done that's specific to, again, the clinically appropriate application of digital technology. Joy, as you had made those last closing remarks, and you refer to, the demand or perhaps the need for creating appropriate infrastructures. When we think about pharmaceuticals as an example, there's a patient insert and there's required language that needs to go along with that. We know from groups like the Consumer Technology Association, CTA, who has put out lots of white papers that speak just to those very things about some of the fundamentals that need to take place. We need to encourage our policymakers to become aware, not only on the need to create for more investment, but on put an emphasis on consumer protection, consumer rights. Particularly as more data, we talked about AI early in the conversation. We talked about data sharing earlier in the conversation. As those things become increasingly more a part of our day-to-day, it's very important that we not overlook the need to protect. It's not just others when we say consumers, it's also ourselves. So I want to thank you all. We will see you next month, in the month of May, where we're looking forward to South Carolina joining us. Woohoo! Their Department of Health and Human Services will be participating. And be on the lookout for information about the virtual HEAL briefing, which will be coming up in the month of June. Until then, everybody, stay safe, have a lovely, lovely spring, and enjoy the rest of HIMSS 23. Take care.
Thank you. Bye-bye.
Bye, everybody.